Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments, such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org.
Love Boise State Public Radio podcasts? They are free to enjoy, but not free to produce. If you can give, your support helps keep shows like Idaho Matters and Scandalize available to everyone. Donate now at boisestatepublicradio.org.
More Idaho Matters now from the studios of Boise State Public Radio News. I'm Gemma Gaudet. Research shows that 356,000 people died in 2018 because of exposure to plastics. The chemicals in plastics could be contributing to everything from high blood pressure to testicular cancer to childhood obesity. They're blamed for 10% of heart disease in people over the age of 55 here in the U.S., and their health effects are being felt worldwide. And these chemicals, well, they're everywhere, from water bottles to aluminum cans to cosmetics. Dr. Leonardo Trusande wears a lot of hats at NYU Langone Health, including director of the Division of Environmental Pediatrics and vice chair of research in the Department of Pediatrics. And he's the author of the book, Sicker, Fatter, Poorer. He's joining us now to talk about his research into the health effects of plastics. It's really nice to have you on the show. Welcome.
Thanks for having me.
So can you begin by just telling us, where do these plastics actually hide? Where are we seeing them?
So first of all, it's important to say that plastics are polymers. They're billions long molecules repeating over time and again. And these are ultimately coming from fossil fuels. Ultimately, the plastic industry is seeing plastics as an off-ramp in the context of attention to the effects of burning fossil fuels. What happens when plastics break down over time through their use, through the entire life cycle, if you want to personify plastics? They're leaching chemicals and micro and nanoplastics. A lot of the attention lately has been on the micro and nanoplastics. It may be that the micro and nanoplastics themselves are causing physical injury to linings of arteries, to tissues, but more likely they're also delivering toxic chemicals. These are additives sometimes to plastics themselves. We soften polyvinyl chloride plastic with phthalates that are used in personal care products, cosmetics, and food packaging. And then there's sometimes impurities that come along for the ride, or just recycled plastic, for example, can carry along impurities from previous lives of that plastic material. And so that's where we can get chemicals ultimately from plastic that penetrate our tissues and hack our hormones, our natural signaling molecules that underlie basic biological functions like temperature, metabolism, salt, sugar, and even sex.
So when you say that, it's found in certain things like lotions, like cosmetics, is that due to the leaching then that is, because a cosmetic sometimes is in a plastic container?
So sometimes it's intentional and sometimes it's unintentional. So you add phthalates to polyvinyl chloride to make that crinkly food packaging wrap, that if it's made of polyvinyl chloride plastic in particular. Sometimes you add it to make sure a scent stays around in cosmetics and certain fragrances. And then sometimes it's just a breakdown byproduct of the material itself. So it depends upon the context. But when we think about prevention, the key is to reduce the use of toxic chemicals and plastics of concern.
So you have said that causation is never certain, but you have been looking at these chemicals and how they could be contributing to a rise in obesity and diabetes. Can you tell us a little bit more about that research?
Sure. So there are 50 or so chemicals that are known to literally make us fatter. So to use a couple examples, bisphenol A, which has been a subject of a lot of controversy because now we have BPA-free baby bottles and sippy cups. Bisphenol A is a synthetic estrogen, so it can have sex-specific effects on body mass. It changes how stem cells are formed in our body, and instead of bone or let's say muscle, that gets shifted over into fat. And so there are multiple biological mechanisms by which these chemicals can make us fatter. Phthalates, for example, change how genes are expressed in our body to respond to the dietary load that we take each day. So you think you had a protein-rich meal, you think you've done a good workout, you think you're going to create muscle. Well, phthalates can change how your genes respond, and thereby you end up having fat instead of muscle. So that's where these chemicals can disrupt metabolic programming.
Hmm. Okay, so what about other health problems? Things like high blood pressure, testicular cancer, even um, undistended testicles, and endometriosis and fibroids in women. Can you talk more about these health problems and any type of correlation?
So again, when you're talking about endocrine disrupting chemicals, there's a lot there that is hard to believe at some level, but it's based in biology. So endocrine refers to these hormones. These hormones operate at
Mhm.
really low levels in our bodies. These are grains in the proverbial Sahara of sand or salt in the Pacific Ocean. And what's happening at these very low levels is they're working by design. They're natural molecules intended to send signals from tissue to tissue, from heart to bone, or from thyroid gland to brain, for example. And so, what's happening there at these very low levels is these synthetic chemicals are sneaking in and either disrupting the receptors directly that are these master conductors in our body, or hormone receptors, or they're changing how genes are expressed and thereby having their effects. That's how sneaky these chemicals are. They're operating at the very same extremely low levels. You would think the dose is the only thing that makes a poison, but in this case, it's not just the dose, it's low level effects that occur. Little things truly do matter. Timing and other factors are really important. And what these chemicals can do is to disrupt hormones that have multiple consequences. So, thyroid hormone is crucial for a baby's brain development. We say that baby relies on mom's thyroid hormone through the second trimester of pregnancy. And even in the clinically normal range, subtle changes in thyroid hormone can have consequences for a baby's brain development, such that even subclinical, clinically normal changes in thyroid hormone are associated with cognitive deficits and even clinically significant conditions like autism and attention deficit hyperactivity disorder. Those same chemicals that disrupt thyroid hormone in pregnancy can disrupt bone growth and development in later life. They can contribute to cardiovascular disease in midlife. And so the age and stage at which you're getting these exposures often dictates the hormonal consequences simply because you're hitting the same hormone at different times.
So when we're looking at babies and children, are they more susceptible to health problems related to these chemicals or not?
So kids are uniquely susceptible for all sorts of reasons. Pound for pound, they breathe in more air, they drink more water and eat more food. They have biological systems that are more vulnerable because they're developing. You can't rewire a baby's brain development, for example. And they have greater years of life in which to manifest disease. But let's be clear, life is a window of susceptibility to these chemicals. So just use one other example that you alluded to at the top. Phthalates are inflammatory factors. They contribute to heart
Mhm.
disease independent of diet and physical activity. Nothing that I'm talking about here, by the way, mitigates the importance of those factors in a healthy lifestyle and healthy heart health, after all. But what we know is that these chemicals contribute to inflammation, they disrupt sex hormones, and thereby can contribute to as many as 50,000 deaths between the ages of 55 and 64 each year. It's a staggering amount, but not implausible in light of the large body of evidence that has also identified phthalate carrying micronanoplastic in the carotid arteries being associated with a fourfold increase in the composite of heart attack, stroke, and death. So, when we're talking about evidence not being causal, of course, we haven't run a randomized controlled trial the way you would with drugs, but you're not going to
Mhm.
ethically dose people intentionally with these chemicals in plastic and expect that to be an appropriate way to do research. You can try to reduce exposure, but it's very hard in the context of the broad exposure that we have from many different sources. So we have to observe people and look at associations and look at that data together with laboratory studies. And that's where the pattern fits, unfortunately, really neatly like a jigsaw puzzle.
So my understanding is that 10 years ago you found that exposure to these chemicals actually cost the United States $340 billion dollars.
Hmm.
And then in Europe that number was $217 billion dollars, and we're talking about healthcare costs.
That's right.
So in your opinion, why do you think those numbers are just a fraction of the actual true cost?
Well, to give you some context, there's 16,000 chemicals in plastic. We know nothing about 10,000. The chemicals we studied in that analysis that contribute, and these are different numbers, different subsets of things, but $250 billion in disease costs in the United States could be related to plastic. That's 1.2% of the gross domestic product. And yet that's based on a dozen or so synthetic chemicals and a subset of effects due to the few chemicals we studied, not to mention a subset of the social costs of the diseases
Mhm.
due to the few chemicals we studied. So you can already see it's an underestimate of an underestimate and of an underestimate. And yet, if you put that number side by side with the revenue of the plastics industry doesn't make revenue more than 500 to 750 billion a year globally. And yet, for what little we know, it suggests that that money is being made off of the backs of adverse health outcomes in millions of Americans.
So let's talk about the plastics that we really do not need. And I know one example you've given is like when you go to the grocery store and you'll see like a cucumber that's plastic wrapped.
Yeah, that's watching a plane crash in broad daylight in clear sight. Yeah, there's really, last I checked, there's a natural layer on that cucumber that's there for a
Hmm.
reason. And in the context of the pandemic, we got a little paranoid about wrapping everything conceivable in plastic for reasons that really weren't based in science. For example, COVID doesn't transmit through droplets that are on the surfaces. They transmit through aerosol. And so wrapping a cucumber in plastic doesn't provide that benefit. What it does do is it provides a fast pathway for phthalates and other chemicals to absorb into food and into our bodies. And so fundamentally, we need to think about using less plastic in contact with food. We need to use more glass and stainless steel. We need to avoid canned food consumption. That's a really fast way to get bisphenols into your body. Um, we can avoid nonstick cooking materials. Those carry PFAS, forever chemicals, that have gotten attention in a movie I like, Dark Waters, with Mark Ruffalo in it. And we can use cast iron and stainless steel instead. We can increase circulation in the indoor air to reduce chemical dust that deposit from electronics and other materials. So these are all safe and simple steps. What's important to emphasize is they don't require a PhD in chemistry and they don't have to break the bank.
Okay, so I've only got a little bit less than 2 minutes with you. So let's say we do all the things you just mentioned and I plastic proof my home. These chemicals that were everywhere. So how can we try to make changes more on a, institutional level?
So we can start local. There are steps maybe with school systems to look at different ways of bringing food to kids. We can talk about steps to reduce the use of chemicals in plastic materials at the state level. There's been leadership in Washington State, New York, Maine, just to name a few states that have gotten chemicals out of plastic materials in those states. And industries can't design different materials in different places. Um, there's been a lot of leadership in the federal government of late. Secretary Kennedy and Administrator Lee Zeldin got together to announce an initiative on microplastics for federal funding to study microplastics, but also efforts to list microplastics in water regulations. These need follow through in the ultimate federal action, but most importantly, there's a global plastics treaty where you're seeing health emerge as the center, where 90 countries are insisting that be a centerpiece of the treaty, including plastic chemicals. So these are all local to global steps.
I want to thank you so much. We've been talking to Dr. Leonardo Tresande, Director of the Division of Environmental Pediatrics at NYU Langone Health, about the effects of plastic on our health. And that'll do it for this episode of Idaho Matters. Make sure you check out our podcast feed because you can find more episodes of topics that might be interesting to you. And for more local news and headlines, make sure you subscribe to the Connector podcast. Find this and other Boise State Public Radio podcasts on Apple Podcasts, Spotify, or wherever you're listening right now.
You know, every day on Up First, NPR's Golden Globe-nominated morning news podcast, we bring you 3 essential stories. At the heart of each story are questions. What really happened? What really mattered? What happens next? At NPR, we stand for your right to be curious and to follow the facts. Follow Up First wherever you get your podcasts and start your day knowing what matters and why.